Good afternoon, everybody. Thank you for joining me for this informative speech. Today's informative speech is about breast cancer. Breast cancer is the #1 silent killer among women. Black women, white women, Hispanic women, all women. Breast cancer is a malignant tumor that starts from the cells of a breast. A malignant tumor is a group of cells that grow into surrounding tissues that spread to different areas of the body. The disease occurs almost entirely in women, but men can also get it. To understand breast cancer, you first have to know the basic knowledge of your breast. This is the breast. This is the lobules, fatty tissue glands. This is the milk duct. This is where milk is produced when you are pregnant. The breast cancer begins to form under here, and that's how you get breast cancer. Most breast cancer begins in the cells that line the duct. Ductal cancer, some begin in the cells that in the lobules, while a small number start in other tissues. The lymphatic system is important to understand because it's one of the ways in which breast cancer can spread. This system has several many parts. Lymph nodes. Lymph nodes are small little nodes under your underarm. They may start to get sore. That's a warning sign. You should check your breast every month before and after your cycle. Breast cancer, as I said before, is the #1 silent killer in women today. Lymphatic vessels are small light veins, except they carry a clear fluid called lymph. It doesn't carry blood. Lymph contains tissue fluid and waste products, as well as immune system cells. Breast cancer cells can enter the lymphatic vessels and begin to grow in lymph nodes. Breast cancer lumps. Some lumps in your breast are not cancerous. You have your benign, which are non-cancerous, then you have the ones that are cancerous. Just because you feel a lump does not mean that it's breast cancer. Lumps do occur monthly in our breast, so that's why the doctors and the FCC and all of those good people suggest that you take your thumb and you feel under your breast. Audience, let's try it. Thank you, Emma. What are the risk factors of breast cancer? Breast cancer in itself is hereditary. Don't let anybody tell you that cancer, breast cancer, throat cancer, colon cancer is not hereditary. Cancer is passed down the family line genes so that, good night, baby. Breast cancer has different risk factors. Exposing your skin to the sun for long periods of time. You may be 20 and think that's cute, but rest assured that by the time you're 40, if you're a fair-skinned person like myself, you will look leathery and you will be prone to breast cancer. That's not a good thing. Not even breast cancer, but cancers, period. Many women get different cancers, whether it be your breast, your leg, your rectal area, cancer form, and all of those things. Lifestyle-related factors of breast cancer risk. Not having children and having them later in life. Some of us get career-minded. When we get career-minded, we may sit and say, okay, let's fast-track it to being an attorney. After that, having children is not on your mind. So you wait till you're about 35 or 45 to have children. That is not a good idea. Your biological clock is ticking. Trying to get pregnant at an older age is not suggested. If you can't do it at 20 or 25, don't do it at all. Another risk factor for cancer, recent oral contraceptive use. Studies have found that women using oral contraceptives, birth control, have a slightly greater risk of breast cancer than women who have never used them at all. This risk seems to decline back to normal over time once the pills are stopped. Women who stop using oral contraceptives have dropped their risk down from 15%. This is stated by the American Breast Cancer Society.com. Using post-menopausal hormonal therapy has the risk of causing breast cancer. Everybody wants to get 35 or 40, maybe even 50. begin to have their private summers or their private winters. That's when they can be sitting in the room with cool air and they just have a hot flash. Some of them choose to use post-hormonal therapy treatment. That can pose a risk for breast cancer. Any women out there currently having menopausal issues?
No.
Okay. Thank you for being honest, ma'am. Do we know what causes breast cancer? There's many risk factors, but nobody truly and honestly knows what causes breast cancer. A few years ago, tomatoes caused breast cancer. A couple of months ago, lettuces and onions caused breast cancer. Many life-altering factors can cause breast cancer. How do we prevent breast cancer? By taking care of ourselves, loving ourselves, avoiding the sun, avoiding tanning beds, tanning salons, avoiding post-hormonal treatments, and unless you're not trying to conceive, just abstain. It's a whole lot safer. Next thing is, this right here is a diagram of how to perform breast self-exams. You lay back, you hold your breast, and you put your thumb in the middle of your nipple, and you just roll around. Do this twice a month, before and after your cycle. Our cycles tend to make us have lumps that are a normal part of life. What occurs once you do get breast cancer? Breast cancer is treated and classified in many groups. One, you can have a mastectomy. A mastectomy is when they just chop them all off. You don't have any. Some women in the older days, back when they were riding coach wagons and things of that nature, with Laura Ingalls, if they had breast cancer, they would have one taken off, and then they would just put an implant in there. Not even an implant. They would stuff a little piece of tissue in their bra because they wanted to have one, because some women don't feel as though they are women if they don't have breasts. Another thing that you can do is have axillary lymph node dissection. This is when they go under your underarm, and if they feel something that's lumpy, they can cut this out, and then once they cut it out, they sit there and they do the little biopsy thing. The biopsy thing can tell you if it's non-cancerous or cancerous, but that's also a waiting period. Those are precious days that you could live your life and just be cancer-free. Avoid sun, avoid tanning salons, avoid hormonal therapy treatment. If you're going through menopause, try natural herbs and remedies. Breast cancer is the #1 silent killer, like I stated before. So please, go to your doctor. When you hit 30, go have your yearly mammogram. Here recently, the FDA changed it. Don't pay that no attention. Allow that to be your time to self, to enjoy life, and be rest assured. The key is to know. Thank you, you all. You all have a great night.